Good morning, everyone. I'm very pleased and I feel actually quite privileged to be able to share these next 10 minutes with you. My wife said, "You seem really nervous about this talk." And I said, "Yes, it's because I only have 10 minutes. I feel like I'm going to get the big hook if something happens, so you have to kind of keep an eye on me. What I'd like to do is share some work that I've been doing with colleagues over the last few years in studies of organizational alliances in public services. And these alliances are voluntary local efforts to try to pool resources among organizations that typically work in an isolated way. I like to say that the blessing and the curse of the modern world is specialization. Every time you look around, you can see very specialized organizations. In fact, those are represented in the careers that Wagner students take. So specialization is great because you can focus and be a focused factory and do really well at what you do, but the downside of specialization is that it creates fragmentation. So many of the problems that our communities and neighborhoods face, not only in the United States but around the world, are profound in the sense that no single narrow solution is really going to work and change the lives of people that we care about. So these multi-organizational alliances that I've been studying, I think, have the potential to really make a difference. And let me give a few examples. In Durham, North Carolina, for example, there has been a coalition working the last few years that crosses typical boundaries. There's people from the school system, there's people from public health, there are people actually from Duke University Hospital, there are social workers, and there are religious groups working together to try and improve public health in Durham. And they've actually been able to move key indicators. They've been able to lower obesity rates, they've been able to improve hypertension, and as a result, hopefully increase the length of lives and the healthy lives of people living in Durham. My colleagues and I, with support from the Robert Wood Johnson Foundation, have been studying similar kinds of organizational alliances across the United States. These alliances, like the one in Durham, are trying to do things such as improve health literacy, improve access to primary care, and launch health promotion programs that will keep people healthy. And they're doing a lot of this work in disadvantaged and vulnerable neighborhoods where it can really make a difference. One thing that's clear, and this is probably true, you know this from your own experience, you don't need any research to tell you this, is that leadership of these alliances is really critical. When I think of leadership, I think of two key components. The first one is helping to set a vision and a mission. Why are we here? What are we aiming for? What kind of a difference do we want to make? Leaders are critical for that aspect. The other thing that I think is critical is bringing people along. How can we get people to roll up their sleeves, commit to the vision, and work on a daily basis to make things happen? These two elements of leadership, I think, are particularly important for alliances. Why? Alliances have to set a mission and vision where there was none, because organizations had been working alone. They have to build a shared vision. These leaders have to help understand what are the strategies and develop the strategies. And you heard earlier that I teach strategic management, so maybe you can come by and we can talk more about that this afternoon. But the leaders also have to figure out how to get things done. How can we get actual working groups of people coming from different organizations and different specialties to work together to make things happen? So the challenges of leadership that normally apply in any kind of organization that you have worked in or that you have lived in, they apply perhaps even doubly when it comes to these alliances, because the leaders of these alliances are working without the benefit of authority. They can't order anybody around. They are working by definition with diversity because they're trying to bring diverse specialists together. And thirdly, they're doing a lot of this without a lot of money behind them. So my colleagues and I wondered about what kind of leadership skills and what kind of leadership styles would be effective in these alliances across the United States. And we had a hunch that there would be some differences depending on what we call the life cycle of the alliance. Does it make a difference what kind of leadership style you use in the beginning when you're launching an alliance like this versus later on when you're trying to reach objectives? So we gathered data over a several-year period from several hundreds of individuals participating in 16 alliances across the United States. We used survey data to try to answer our question and understand leadership in these contexts and open up the black box and see if we could understand what really is making a difference and what's adding value for the participants of alliances and the communities that they serve. After doing a fair amount of analyses, we came up with some very interesting conclusions, and they're probably common sense to you, and I'm going to come back to that point in a minute. But the first conclusion we came to is that leadership style does differ. Effective leadership style and the practices that leaders use do differ over time if you're going to be successful. In the beginning, what we found to be most successful was an open and inclusive leadership style. In other words, on the front end, how do we get people together, come to the table, and try to get them talking to each other, understanding each other to help develop a common vision and a direction that we want the alliance to go in. Over time, the leadership style that was effective shifted. The leadership style that mattered over time was being more task-focused. Okay, we have set a vision, you're with us or you're not, let's roll up our sleeves and actually get work done. So the front-end leadership style and what happened over time and whether or not members of the alliance and community members themselves felt like the alliance was actually achieving what it set out to do differed depending on the leadership skills that were brought. So you might say to yourselves, well, that sounds pretty easy. In fact, that sounds pretty intuitive, but not so much. And I'll tell you why. Research, and again, as well as common sense, show you that leadership style switching is not so easy. A lot of you probably have a natural leadership style, what feels comfortable to you. Shifting that style over time may not be so easy, and in fact, what research, and again, your own experience probably shows you, is that when you're under stress and you're dealing with a very uncertain kind of objective, like leading and building one of these community alliances, and you're feeling uncertain and anxious about the task, the actual style that most people use is more autocratic, okay? Not actually listening much to what others have to say, but trying to sort of boss them around and figure out, let's get this done so that I can reduce my uncertainty and my anxiety about it. So I think that one of the most important things to consider in your time at Wagner, and I'm looking forward to seeing all of you here in the fall, don't make any mistakes about that. What I think is important for your time to consider here at Wagner is how can you develop your own leadership skills? What can you learn about your own leadership styles? What can you learn about how you react under pressure? Are you someone who actually will become more autocratic when you actually should be doing more inclusive and open-ended problem solving? Will you be task-focused when the time comes? And I think critically, it's important to ask ourselves the question, is leadership a team sport? Are there ways that I can complement my own leadership development and skills by involving others who have complementary and diverse perspectives to bring to bear on the problems there? I think Wagner, for all of the reasons that you've heard this morning, is the ideal place for you to develop the kind of leadership skills that you will need to effectively lead these organizational alliances in communities and neighborhoods across the country that we so desperately need. We need these alliances, we need effective leadership, and we need you and your commitment to make that happen. So I welcome you again to Wagner. I'm delighted that we'll have a chance to get to know each other a little bit more this afternoon. Thank you very much.